People who have cystic fibrosis maintain better health when they routinely clear mucus from their airways using chest physical therapy. This treatment technique can be performed at home without expensive specialized equipment by physical therapists or even trained family members. Here at Chest Physical Therapy Services, most of our patients have cystic fibrosis, which causes thick pulmonary mucus secretions. This is a demonstration of the chest physical therapy program we have been successfully using for more than 25 years to clear mucus from the bronchial airways of our patients. Chest physical therapy can be used to clear mucus secretions caused by other pulmonary disease conditions as well. With practice, you can learn to do chest physical therapy for your patient or family member, and with some persistence, you will be able to perform these techniques very effectively. This demonstration program provides you with a valuable tool with which to fight against the advancement of obstructive pulmonary disease. Chest physical therapy is a tried and true treatment. Like any skill, it requires practice and commitment to do it well. But we feel that nearly anyone who gives it an honest try can become a very good chest therapist. Chest physical therapy is a beneficial procedure for those patients and families who want to do everything possible to halt the advancement of pulmonary illness. No special equipment is necessary to perform chest physical therapy, but one item the patient needs is a proper shirt. We are going to place the patient in various positions. These are called postural drainage positions. We do this because the lung is divided up into various segments. Each segment has a bronchial tube, and we want gravity to assist us in draining the mucus from that tube. There are 11 different postural drainage positions that we use to drain the various segments. To get our patient into the various postural drainage positions, we're going to need some sort of equipment. In this video, you're going to see us use this very nice table that we have, but you can devise other methods at home. One good method that we've seen is a padded board, which is a piece of 3/4 inch plywood covered with foam rubber and then covered over with corduroy material. You'll note that the grain of the wood goes the long way. Another very simple system uses couch cushions and pillows, as shown here. Percussion to the chest is done with the hands in a cupped position with the fingers together. The hand should make a popping sound when it contacts the chest. It should not be a slap. During percussion, be sure to stay on the chest and avoid the area below the ribs. Keep your hands 3 finger widths away from the lowest rib. Make sure the shirt lays flat with no wrinkles. Practice with one hand first, then try the other. The popping sound is caused by a cushion of air that allows quite vigorous percussion without hurting the patient. You will be percussing for 2 minutes in each postural drainage position, and 2 minutes will probably seem like a long time initially. Your stamina and technique will improve. The secret, like any skill, is practice, practice, practice. After 2 minutes of percussion, we perform 5 vibrations to the chest wall. The therapist's hands are placed firmly on the chest, but do not press down on the chest. The patient takes a deep breath in and then exhales through pursed lips, making an F sound. During this exhalation, the therapist does the vibration by tensing all the muscles in both hands, arms, and shoulders so much that they shake a little. This vibration is transmitted to the chest wall and lungs. It helps to keep both hands in contact with one another during vibration. It may not feel like you're doing very much, but the patient will tell you when they can feel the vibration. A good cough is most important for airway clearance after percussion and vibration. Some patients may be embarrassed to cough or expectorate mucus, but it is important to encourage coughing. It's best for the patient to sit up, and the patient should take in a deep breath and hold it for a second before coughing. The patient should cough after percussion and vibration in each postural drainage position. Yet remember that coughing can be quite fatiguing if one is very congested. The patient may need a rest period after uncontrolled spontaneous coughing. Now we'll put it all together for you and demonstrate each postural drainage position with percussion and vibration. In each position, for demonstration purposes, we'll show you some percussion and a few vibrations. But remember that 2 minutes of percussion and 5 vibrations are recommended in each position. If any of the positions seem to be productive of a great deal of mucus when the patient coughs, it is beneficial to go back and treat those positions a second or even a third time. first 5 positions are for the upper lung segments. The first position is sitting, leaning slightly forward. Be sure to smooth out the wrinkles in the shirt. Keep your hands cupped and your fingers together. This is a good position for practicing percussion. Remember, percussion should not hurt the patient, and the patient will tolerate more vigorous percussion over time. For this first position, the therapist percusses between the neck and the shoulders with the hands positioned as shown. After 2 minutes of percussion, we do 5 vibrations. The patient takes a deep breath in and then exhales, making the F sound. During this exhalation, we tense our arms and shoulders to vibrate the chest wall. Then the patient coughs. The second postural drainage position is sitting once again, but leaning back slightly. Percussion is on both the left and right side of the chest and front. Do not percuss on the collarbone or any bony area for that matter. Once again, after 2 minutes of percussion, we do 5 vibrations and a cough. The third position we refer to affectionately as hug-a-pillow. The right and left side are done about the same way, and for this third position we'll do the right side. The patient lies on a postural drainage table or couch that is flat and hugs a pillow with the right arm and shoulder so that he is rolled slightly onto his left side as shown. Percussion is to the right shoulder blade area. Avoid the spine in the middle. The right arm can be positioned to flatten the shoulder blade so that the therapist's hands fit more comfortably and a better popping sound is obtained. Adjust your hands as necessary. Once again, 2 minutes of percussion followed by 5 vibrations. The patient should remember to take in nice deep breaths followed by exhalations, making the F sound through pursed lips. The therapist should remember not to push on the chest during vibration. Just maintain good contact with your hands. For position number 4, we're going to do hug-a-pillow on the left side. This is essentially the same as on the right side, except that we want the patient tipped up just a little bit. We're adding some pillows here to accomplish this. During this sequence of vibrations, you'll see the patient breathing through pursed lips during exhalation to make the F sound. Postural drainage position number 5 is lying flat on the back as shown. Percussion is on both the left and the right side of the front of the chest. The hands are placed so that the fingertips are just below the collarbone. Do not percuss on the collarbone or any bony area. Adjust your hands for comfort and a good fit on the chest wall for a good percussion technique. This is a good view of the vibration technique. Keep your hands firmly on the chest wall, but don't push hard. Just follow the ribs down as the patient exhales. For position 6, find the lowest rib and move up about 3 finger widths. We're going to be careful about percussing too low on the chest wall. In this postural drainage position, the patient is lying on his right side so that we can percuss the left side. The patient lies on cushions or pillows to obtain a considerable tipped down position. For postural drainage position number 7, we're going to stay on our left side, but we're going to roll about a quarter of a turn onto our back. It helps to put some pillows under the back for support. As you can see, the left arm is held up over the head. Percussion is done on the left side of the chest, just beneath the armpit, and even a little bit into the armpit. Some patients jokingly call this position the pits. The breast must be avoided when treating female patients. While in male patients, percussion can be done over the breast area if it is tolerated. For position number 8, you can see that we've continued to roll our patient a bit like a log onto his back, maintaining the tipped down position. You can see that both hands are percussing the right side of his chest. That's because we have room. With female and smaller patients where we don't have such room, we can do both sides of the chest at the same time. This can actually be more difficult for the therapist to accomplish. If so, you can use one hand at a time. But if you have the room, we feel that it is best to do both sides separately. Just be careful not to go too low on the front part of the chest. Patients can get very sore there easily. We're going to do 2 minutes of percussion for each the right and the left side, along with 5 vibrations and a cough for both the left and the right side. And here we are, keeping our promise to do the other side, position number 9, the left side of the chest. We count the left and the right side of the chest as 2 separate positions. However, if the patient is female or a young child, and you combine both sides, then that is only one position. Remember, 2 minutes of percussion in each position is a minimum. If it seems necessary to do more due to airway congestion, by all means percuss longer. And again, if any position seems to be productive of a great deal of mucus, go back and repeat that position. Position 10 is the same as position 7, once again, the pits. The right side is done the same way as the left side. You may have noticed that at the beginning of the video we suggested sitting up when coughing. This patient has not done so throughout the entire video. It's more important to sit up when a patient is quite congested. This particular patient has fairly clear airways and feels very comfortable staying in the position while coughing. And please remember, patients, that there is no gum or candy or anything else in the mouth, and you should wait a few hours after eating before doing chest PT. If the patient is able to cough out mucus into a cup or tissue, you should note the color, the thickness, and the amount, and report this to your physician. You should also note any changes in these. Of course, if there is ever any blood or bloody mucus, you should call the doctor. Tissue should be properly disposed of, and any reusable containers should be washed out with antibacterial soap. Position number 11 is again lying on the side with the head tipped down. This time we're doing the right side, just as we did the left side. As on the left side, you want to find the lowest rib and then stay about 3 finger widths higher on the chest wall than the lowest rib. Many people find vibration more difficult to learn and to perform than percussion, and it actually can be more fatiguing. And the patient feels more than the therapist seems to be doing. Position number 12 is performed with the patient lying on his stomach using some pillows to be in a head tipped down position. We will percuss and vibrate the left side of the chest for position 12 and the right side of the chest for position 13. For smaller patients with limited room, you can do the left and the right side together so that this becomes one position. As with the side-lying positions, we want to find the lowest rib and then stay 3 finger widths up on the chest wall from the lowest rib. With some vibrations and a cough, our chest PT session is completed. We hope that this video demonstration helps you to learn the techniques of chest PT. Remember that the treatment of chronic airways disease is a marathon, not a sprint.